person who has been formally trained in yoga. Nonetheless, by virtue of being with people who have been propagating yoga for various purposes, I was attracted to using yoga for treating psychiatric illnesses. Although the topic is yoga and health, mental health, a little variation from this, yoga in mental illness is what I have been working on in the last decade or longer. So in this keynote address, what I would possibly present is our experience of using yoga in a disorder, depression. So in this brief talk, following are the headings in which I will cover what I wanted to present, in this talk. Depression is a mental disorder. It has several clinical features. Before I continue, I don't know how many in this audience would be medical people and how many are not medical people. In a previous talk at Sydney, I was told that it was too technical. At the same time, some of the medical people came and told me that it was extremely simple. So it seems it's very difficult to come to a meaningful midpoint where I would be acceptable to both groups of people. With that, not sure if this is seeable at your end. Are you able to read this talk? In which case I may not refer to this when I talk. Is it readable? Yeah, okay, then. Yeah. It is as depressed as the slides are. That's about it. So there are various reasons, various symptoms of depression. It is a condition wherein a person is affected with a low mood. It's commoner in women than men. Could affect all ages. And depression is the condition, although it's a very common condition, more importantly, it is going to be a condition which contributes to the burden. In fact, it is one of the highest contributors to the disease-induced burdens in the community. There are various symptoms which are characterize depression: feeling low, having poor interest in work, trouble in falling asleep, losing appetite, losing weight, feeling guilty about all actions, blaming himself with very low self-esteem, and having cognitive symptoms of difficulty in concentration, difficulty in memory. The individual can be slow, he can have suicidal thoughts, and unfortunate individuals could also complete in suicide. They affect virtually all walks of our life when we get depressed, and the symptoms are not explainable on a basis of any event that has happened, and they tend to last a little longer. Luckily, good number of depressive episodes remit after a period of harassing us for periods of couple of months, sometimes even up to a couple of years. Again, unfortunately, these episodes could recur even though they remit totally. And as the age goes on, the frequency at which the episodes come back get more often. And the difficulty in treatment becomes more and more evident as the depressive episodes recur and in the later parts of the life, the treatment can become even more difficult. Clinicians have recognized largely a major depression and a minor depression, depression occurring with many other medical conditions, many other psychiatric conditions, drugs of abuse being one of them. Depression, once recognized, needs to be treated. We use medicines or many other medical lines of treatment. There could be psychosocial approaches wherein we talk to the patient, talk to the families. There are various formal methods of applying the psychological treatments in depressive disorder. And we have a host of what we call as alternative medicines, in which we talk about yoga. Is it indeed an alternative treatment? Is it a complementary treatment? These are the research questions people have been looking at in the last decade and a half, or is more than that. Interestingly, when I earlier gave a talk, one of my teachers came and told me that should you be referring to yoga as an alternative treatment? It is the treatment, and other drugs that you are using in allopathy are indeed alternative. Largely, it's true that a good number of illnesses that occur, that present to us in psychiatric clinics may not necessarily need an antidepressant drug. We could, of course, treat them from yoga applications. Allopathic treatments, in which I have been trained formally, have been effective. They work in a good number of depressive individuals, but nonetheless, substantial number of them don't get better. And we go on with additional allopathic interventions. Some of them are indeed invasive, and we go on until we have reached a stagnation. Alternative systems have been searched for various reasons. One, of course, can it be merely an alternative to drugs because the drugs produce some side effects, etc., etc. Can they be complementary? The drugs don't produce good enough improvement, and so I want to add the alternative systems, which here for this audience we refer to as yoga. In spite of all the interventions, it is feared that depression is going to emerge as one of the leading causes of disease-induced burden in the world. In fact, in very short term, in 2030, it would be the cause, the first cause contributor to the disease-induced global burden. It is already in position 3. It's going to shortly become position 2, and it's going to become position 1. Hopefully, with the applications of yoga systems and other methods of improving our own mind by these attempts, we hopefully are able to conquer this and may be able to pull it down from the number 1 position to maybe 2, 3, even 4th position. Yoga approaches have been introduced in psychiatry, in mental health, from different schools of yoga. Whereas yoga is taught as a generic discipline in PhD courses, in MSc courses, in bachelor's courses, in different parts of the country, in India and also in different parts of the world. And my attention has been to use these generic forms of yoga, pull it out from traditional texts, validate by way of consensus across yoga therapists, and put them into a module of yoga for purpose of treating disorders. Here, of course, depression as one of them. And we, of course, have been researching into yoga in depression, looking at various neurobiological mechanisms of yoga. Swamiji did mention yoga chitta vritti nirodha. This is what has been said by Patanjali. Much earlier to Patanjali, In the Gita, it is referred to as yoga, samatvam yoga uchyate. Equanimity is yoga. Much earlier to that, Yoga Vasishta, one of the important treatises on yoga, it does refer to yoga as manah prashamanopaya, what gets your mind better. All the feeling of disquiet getting better is what is yoga. So for these reasons, yoga has been used in psychiatric disorders, improving mental health. Yoga is not just some postures or some breathing exercises. It is a set of activity for a lifestyle to improve our own living. But for purposes of treatment in psychiatry, we have focused ourselves on two important aspects of the yoga: the yogasana postures, the pranayamas, the breathing components of the yoga practices. The reasons why we limited to these two applications in disorders is because that in ill individuals who may not be able to concentrate on other deeper methods of yoga practices, we will not be able to verify indeed if they did practice what we wanted them to practice. Yogasana and the pranayama are verifiable procedures and can actually be checked whether these people are indeed practicing this, and we have found that this verifiability makes a lot of difference in people who have otherwise been ill with their mental state. So this is a picture of the yoga center at Nimhans. It is of important it is important to note that in a very well known allopathic hospital, yoga has been integrated into applications of treatment with the institute's authorities establishing a yoga center where we see close to about 30 to 40 patients coming for yoga from mental disorders, childhood disorders, neurological disorders who seek yoga as a treatment for their conditions. Various benefits of yoga in mental health and neurological conditions have been reported in the literature, starting from their improved performance in psychological tests, reduction in stress hormones, and so on and so forth. All these things indicate that yoga could potentially help illnesses, and that's why we wanted to do use yoga in applying to mental illnesses, depression here for present discussion. There have been several limitations of yoga research. Much of the work has been done in healthy populations, and in those who are seeking yoga in yoga classes, yoga camps, and so on and so forth. In them, depression was measured, and then they found that the depression got better, or any other anxiety or blood pressure or glucose levels. Direct application of yoga in illness individuals has not been very many, and this challenge has to be faced. In fact, one of the recent reviews which looked at yoga in neuropsychiatric disorders got about 124 studies which conformed to some degree of standards, but only 16 could be found acceptable for this meta-analysis. So these limitations, and more so, allopathic doctors as what we are tuned to looking at results in what we call as double-blind research studies, wherein people get a test tablet, and an identical looking tablet is given to another individual, and the fellow who received the test tablet should have become better than those who received identical looking placebo tablets. This placebo component of yoga research is another interesting challenge we have really not been able to overcome successfully. Limitations apart, yoga has been found to be useful in mental disorders, I'm going to demonstrate some of them in depression here. With all this, there are some barriers of practice of yoga. Hospitals where I work, we ask them to come daily for yoga for a week, for a fortnight, for a month. They have great difficulties in accepting to come on a daily basis. And the yoga specialists don't believe in prescribing yoga as an outpatient. You follow these exercises at home, follow these postures at home. They believe in actually hands-on training of yoga practices. So these are all the barriers which we need to overcome in case we need to get these people to practice yoga for getting their depression better. In our earlier studies of depression, we used yoga from one school of thought. We found that yoga was as effective as antidepressant drug. We also found that yoga not only got their depression better as they reported, the measures of cognition using a cognitive event related potential, which was lower than healthy subjects when they were ill, when they got better after yoga, the cognitive event related potentials amplitude got as well as those of healthy subjects, indicating that it did produce a biological effect on the brain, which perhaps was influential in getting their depression better. A very recent meta-analysis of yoga research in depressed individuals. They had 10 studies. In that, they found depression got better. The effect sizes, which means the degree to which the treatment produced benefits, was substantial for clinical applications. I will illustrate the yoga effects in depression using some of the recent studies which was not included in this meta-analysis which was published in 2013. In our study where we had opportunity to prescribe yoga for people who came in the outpatient clinic, they were not suicidal, they were not severely depressed, but they did have clinical depression in our outpatient clinics, and they had improvement following yoga applications. Yoga plus, that means yogasana and pranayama, drug alone, or yoga plus drugs. Yoga alone, people got better. The drug alone group, all of them did not come for follow, and I don't want to say that the drug was inferior to yoga. That was not the design in which we examined this question in this study. But yoga did produce substantial reductions in their depression scores. The questions which we looked at are, how did yoga produce this change? What were the ingredients by which it got the persons better? In patients with depression, there is a poor neuroplastic effect. The brain doesn't get repaired on its own if depression occurs. On the other hand, the brain could also decay faster if depression occurs. There is some evidence to this from various biological experiments. One of them is, there is the chemical what we call as brain-derived neurotropic factor, which repairs the brain. And this is lower in depression compared to healthy subjects, and this gets better if you treat them with any antidepressant treatment. Here it could be yoga, it could be antidepressant drugs, and in fact yoga alone got them better. The brain-derived neurotropic factor in these individuals went up following yoga applications. Yoga alone, not yoga plus antidepressants. The more regular the person practiced yoga, the higher the BDNF, that is the brain-derived neurotropic factor in the blood, rose. Very interestingly, this relationship of increase in the levels of the brain-derived neurotropic factor was also correlated with their improvement in depression, the red line. The other two lines are the ones where the drugs were given, and I don't know the drug effects on this BDNF. At this point of time, I want you to ignore this. But the red line which indicates that the more effective was yoga in producing antidepressant effects, the more effective it was in increasing this neuroplastic factor, a neurotropic factor in the blood. So which means the yoga could well be acting through its mechanisms on the brain. Stress hormone cortisol is elevated in depression. It's fairly well observed phenomenon across various studies elsewhere. The numbers of people who after the treatment for depression, whether they received yoga, whether they received antidepressants, drugs alone, or a combination of both, the numbers of people who got their cortisol levels dropped was substantial. In fact, when yoga was added, this number was quite big. It is higher numbers of people got their stress hormone levels lowered following practice of yoga in depressed clinical situation. Interestingly, the degree to which the cortisol fell also was related to the antidepressant effect, which means yoga was reducing stress and by that way was also reducing their clinical depression. Very interestingly, in those people where the cortisol levels dropped, in them, the blue line, the brain-derived neurotropic factor went up, which means there could be a link to yoga. It reduces stress, it reduces the cortisol levels, and in turn it was increasing the brain-derived neurotropic factor, which in turn could be helping the individual to get over the depression. This cycle of event needs to be confirmed in more rigorous research, but these are the leads that we have got in this particular clinical research that we were able to complete. Not only did the depression get better, their cognitive state got better. The red line, the higher the BDNF rose, the quicker they were able to perform a neuropsychological test. They took shorter time to complete the test, which means depression as symptoms got better, the cognition in individuals with the depression also got better following yoga. Are there any other mechanisms that are involved in yoga producing antidepressant effect? This is some research leads that people have been able to furnish from different other angles. One of the researchers in New York was able to find a neurotransmitter called as the gamma aminobutyric acid, which went up following an acute session of yogasana. In fact, the GABA levels in the brain now can be measured using a technique called as magnetic resonance spectroscopy, which is a non-invasive but in vivo measurement of this transmitter inside the brain. He found that this transmitter went up following yogasana practices. Is it likely that the same thing happened in our individuals who practiced yogasana? It's an issue that remains to be tested, but we know that the GABA levels going up can make the individuals less anxious and also less depressed. So there is some indirect evidence that this is operating. I also talked about the neurotropic effect, brain repairing itself. Did it happen in actual situation of our depressed individuals? Although I did not do this examination in our depressed subjects, another investigator in our own laboratory who taught yogasana for a period of 6 months in elderly individuals, those who are 60 years and above, who practiced yogasana for a period of 6 months, in elderly individuals actually brain starts losing itself, starts shrinking. On the contrary, after the practice of yoga, an area called as hippocampus, which is highly sensitive to the effects of the brain-derived neurotropic factor. This area of the brain, the grey matter actually got more. The volume of the grey matter increased statistically, and this is what he found. Did the same thing happen in depressed individuals? A question that we need to examine later. And interestingly, amongst the components of the yoga practices, one of them is chanting Om. While Om was chanted, some areas of the brain became deactivated. When we become emotional, some of the limbic areas of the brain become very active. And in depressed individuals, these areas are found to be increasingly activated during depressive emotions. And when Om was chanted, these are healthy subjects, these are not depressed individuals. In the healthy subjects, some of these selected limbic areas were actually deactivated. So is this another mechanism by which yoga produced antidepressant effect? This is possible, it remains to be actually tested in individuals with depressed clinical situation. Applying these technologies, something that we are likely to be doing in the years to come. All what I presented has already been published in a recent supplement of the Indian Journal of Psychiatry, which is available on the internet, free for most of us. So in summary, since before the bell is made, I thought I was complete. In summary, yogasana and pranayama, as what we have done, produces antidepressant effects. It not only gets depression better, it normalizes cognitive function. Outpatient depressive subjects had lowered levels of the brain-derived neurotrophic factor, which could make the brain decay or not get repaired as fast as all of us otherwise healthy. Yoga elevated this level, the levels of the brain-derived neurotrophic factor, yogasana, not only getting them better in depression, also got this neurotrophic factor elevated following yogasana practice. The relationship of antidepressant effect was quite well demonstrated with this potency to increase the brain-derived neurotrophic factor. The BDNF rise was also related to improvement in cognition in depressed individuals. Cortisol levels were elevated in depression and it got lowered following yogasana, and the degree to which the cortisol levels lowered was also related to the extent of increase in the levels of the brain-derived neurotrophic factor. And there could well be other neurobiological effects of yoga which could have an indirect influence on depression, which remains to be demonstrated in future research. So this summarizes what I wanted to present. There are several people who helped me in conducting this research in our group. Thanks to Sri Nagendra ji, who has been a source of inspiration in me taking up yoga research at NIMHANS. There were many other contributors that included the Morarji Desai National Institute of Yoga, which helped us get some funds for all this research work. And of course, my own colleagues and our director who helped me in completing this work. I'm available for answers, questions, any other questions you want to ask and get me to answer those questions. Please do send your comments on the email which I have indicated there. And of course, what I did present is available in the websites of the PubMed that's already been published. For more of you, for any one of you who is interested in more technical information, these are already available, including the practices of yoga that I talked about have already been published in these researches. With this, I thank Rajendra for letting me come over here and share these observations with all of you. I thank all of you for patiently listening to me in this lecture. Thank you.